Heart disease is the #1 killer of women in the United States, affecting 1 out of every 3 women annually. That's about 1 woman dying every minute from heart disease. And 90% of women living in the United States have at least one risk factor for heart disease. So it is very, very important that we know our risk factors and that we get appropriately screened. A lot of heart disease is preventable, so if we take action now, we can certainly prevent a lot of the bad outcomes. Heart disease is a really broad term. I think most commonly when we think about heart disease, we think of coronary artery disease, which is blockages in the heart arteries, but it can also encompass things like heart failure, heart rhythm problems, heart valve disease, even congenital heart disease. Women do have a lot of the same risk factors that men do for developing heart disease, so things like having diabetes, smoking, being overweight, having high blood pressure, or high cholesterol. But there are risk factors that are unique to women that can also put them at risk for heart disease down the road. And I think some of this may be really surprising to women. So for example, endocrine or hormonal abnormalities that are particularly unique to women, like polycystic ovarian syndrome, also women that have autoimmune or collagen vascular disorders like rheumatoid arthritis or lupus, also put them at risk for heart disease. A lot of my patients are also surprised to find out that issues that they may have had when they were pregnant, like having gestational diabetes, preeclampsia, or gestational hypertension, may also put them at risk for heart disease. I think that heart disease among women is particularly deadly because women tend to present much later than men in their disease course. Symptoms among women can be really non-specific. They may just be feeling fatigued, tired, have some shortness of breath, and those are really common symptoms and symptoms I think women can experience from a lot of different things. But a lot of heart disease is preventable, so if we take action now, we can certainly prevent a lot of the bad outcomes. There are a lot of tools that are available to help women to know their risks. One of these screening tools that's available is here at Piedmont, and that's the Women's Heart Screening Program. The Women's Heart Screening Program is really geared towards women that are currently asymptomatic, meaning that they don't have any current symptoms that may be related to heart disease. If you do have any symptoms, then you should certainly go see your doctor or your cardiologist right away. But for women that are just more curious and want to be educated about knowing their risk for developing heart disease, the Women's Heart Screening Program is a great tool. So you're going to get a really comprehensive visit with one of our nurse practitioners. They're going to take a complete health history, a great physical exam, and do a lot of in-depth blood work to help you know your risk.